Go.
Okay, Karen, now that the clinician has checked over the health history, we can proceed with the rest of the appointment. We're going to start with some assessments, starting with the vital signs, which includes blood pressure and heart rate. Would that be okay, Karen?
Yes, sounds good.
Okay, perfect. We'll start by taking your blood pressure. First, we're going to begin by wrapping the blood pressure cuff around your upper arm. Then I'm going to start by pumping the blood pressure cuff so you may feel it start to get tighter as I continue to pump. The reason we suggest taking blood pressure is to ensure there are no health risks, so we can proceed with the rest of the appointment.
Okay.
Everything is good. Your blood pressure reads 120/79.
Perfect.
So now that I have your blood pressure reading, I will proceed with taking your heart rate. So I'll use my stethoscope and place it on your chest and then on your back. It might feel a little cold at first. We suggest taking your heart rate so we can be aware of any health risks that could be affecting your well-being throughout the appointment.
Okay, sounds good.
Your heart rate reads 73 beats per minute, which is a good reading.
Okay.
Now that I've documented your vital signs, we can continue with the rest of our appointment. So if you don't mind, I'd like to do an extra oral exam. What this is I'm going to use my hands and feel around your head and neck area, just looking for abnormal lumps and bumps.
Okay, sounds good.
Okay, so I did not feel anything abnormal in your head and neck area, which is great to see. Now, since we finished the actual oral exam, I'd like to begin with an intraoral exam. For an intraoral exam, we just make sure that there isn't anything concerning going around in your teeth. Is it okay if I take a look?
Of course, whatever you need to do.
Everything looks just fine inside. The next step to the assessment has to do with the gums surrounding the teeth and the underlying surfaces of the gums in the teeth. It's called probing and exploring. First, we will be doing the probing portion. When we probe, we just use this instrument here to check how deep the space is between the gums and the teeth. We do this for every tooth on both the front and the back surfaces of the tooth. Do you mind if we move along with the next step to the assessment?
For sure.
Everything from that is now recorded in your charts. So far, so good. Next is something called exploring. For exploring, we just use an instrument called the Explorer that gently goes under the gums to feel for anything abnormal that could be on the tooth, under the gums, that we can't see ourselves. This just makes sure that everything is taken care of, contributing to your oral health. Is that okay with you?
Yes, thank you for being so informative.
Perfect. Thank you so much for your cooperation during this part of the assessment. I think we are ready to have your charts checked by the clinician here, so that way we can get started with the rest of the procedure today.